Welcome to the Therapy Trainings Podcast, your go to resource for enhancing your practice and deepening your understanding of mental health. I'm thrilled you're joining me today for a companion episode to the course Concurrent Doc offered by Therapy Trainings. This course dives deep into the complexities of concurrent documentation, a vital skill for mental health professionals. In this episode, we're going to explore the key points from the course, highlight some important insights, and address common misconceptions surrounding concurrent documentation. By the end, you'll have a clearer understanding of how to effectively integrate these practices into your work, ensuring that your documentation supports both your clients and your practice. So let's get started. First, let's talk about what concurrent documentation really means. In the context of mental health, concurrent documentation refers to the practice of documenting client interactions and treatment plans in real time, or nearly real time, rather than waiting until after the session. This approach has several advantages, both for the therapist and for the client. One of the cornerstone principles of concurrent documentation is that it enhances the therapeutic process. Think about it. When you document during the session, you're capturing the client's thoughts and feelings as they articulate them. This immediacy allows you to better reflect on their words and emotions, making your notes richer and more accurate. This is particularly useful in therapeutic settings where nuances matter greatly. Imagine a client discusses a particularly sensitive issue during a session. If you wait until after the session to document their feelings, you might miss out on the emotional intensity they conveyed. Conversely, by documenting concurrently, you can capture those critical moments and ensure that your records truly reflect the client's experience. This also opens up opportunities for the client to clarify or expand on feelings right then and there, leading to deeper insights. Now let's delve into the second key point, the efficiency factor. In our fast-paced world, time is precious. Concurrent documentation not only saves time in the long run, but also helps in keeping your thoughts organized. Instead of scrambling to remember what was said during the session, you're jotting down notes while everything is fresh in your mind. This minimizes the risk of forgetting important details and makes the end-of-day paperwork much lighter. And let's be honest, who doesn't want to avoid that dreaded mountain of paperwork looming over them at the end of a busy day? By integrating documentation into your sessions, you can leave the office feeling accomplished, having completed not just the therapeutic work, but also the necessary administrative tasks. However, it's essential to recognize that concurrent documentation isn't without its challenges. One common concern that many therapists have is whether it might create a barrier in the therapeutic relationship. After all, the act of writing can be distracting, but here's where the course offers invaluable strategies. Therapy Trainings teaches us how to balance this practice. For instance, you can use a laptop or tablet that's unobtrusive, or even jot down notes on a notepad if that feels more natural. The key is to maintain eye contact and engage with your client while documenting. It's about finding that sweet spot where you can be present and attentive while still capturing essential information. Now let's tackle a few misconceptions about concurrent documentation. One of the most prevalent myths is that this practice leads to less authentic interactions between therapist and client. Some professionals worry that focusing on writing things down will shift the focus away from the client. However, the reality is quite the opposite. When done correctly, concurrent documentation can actually enhance authenticity. By taking notes during the session, you're demonstrating your engagement in the process. It's a signal to your client that their words matter, and you're valuing their experiences enough to capture them accurately. It can also foster a sense of collaboration, as clients may appreciate seeing their thoughts documented and validated in real time. Another common misconception is that concurrent documentation is only for certain types of therapy or specific populations. Some therapists believe it's only effective in structured settings, like cognitive behavioral therapy. But in truth, concurrent documentation can be adapted to any therapeutic approach. Whether you're practicing psychodynamic therapy, humanistic therapy, or even art therapy, you can incorporate this technique in a way that suits your style and your client's needs. Now, let's talk about some practical tips for implementing concurrent documentation into your practice. One strategy we learned in therapy trainings is the use of templates. Having a structured format can streamline the documentation process, ensuring you capture critical elements without getting bogged down. Templates can be customized based on the type of session or client. For instance, you might have different templates for individual therapy versus group therapy. This not only saves time, but also helps maintain consistency in your records, making it easier for you to track progress over time. Another effective technique is to set specific times during the session for documentation. For example, you could let your client know that you'll be taking a few moments to jot down notes at the end of the session. This way, you're communicating openly and reducing any potential distractions. You might also consider using voice-to-text technology if you're comfortable with it. Some therapists find that speaking their notes aloud allows for a more natural flow of documentation. Just be sure to maintain confidentiality and ensure that your workspace is secure. Finally, don't underestimate the importance of self-reflection. After implementing concurrent documentation, take some time to evaluate how it's working for you and your clients. Are clients responding positively? Do you feel more organized? Continuous improvement is key in our field, and being open to feedback will help you refine your approach. As we wrap up this episode, let's reflect on the significant impact that effective documentation can have on your practice. Concurrent documentation isn't just about keeping records. It's about enhancing the therapeutic relationship, improving outcomes, and making your life as a mental health professional more manageable. I encourage you to consider how you can integrate these concepts into your work. If you're intrigued and want to learn more, I highly recommend checking out the Concurrent Doc course offered by Therapy Trainings at therapytrainings.com. It's filled with practical insights, strategies, and tools that can elevate your practice to the next level. In conclusion, concurrent documentation can serve as a powerful ally in your therapeutic toolkit. By embracing this practice, you're not only improving your documentation skills, but also enriching the therapeutic process for your clients. Remember, it's all about engagement, efficiency, and authenticity. Thank you for tuning into the Therapy Trainings podcast. I hope you found this episode insightful and that it inspires you to explore new ways to enhance your practice. Don't forget to visit therapytrainings.com for more courses and resources tailored to meet the needs of mental health professionals. Until next time, take care and keep supporting your clients with the excellence they deserve.